One of the most important things a modern health service must do is to listen to its patients, to give them real voice. Without that, it can't guarantee properly safe services, it can't guarantee a service that's really improving outcomes for its patients. And that's why a year ago we introduced something called the Friends and Family Test, which is this amazing opportunity for people to feedback, to give us their views on the quality of services that they're receiving. And on one level, it's about asking people just to be really frank about how a local service is delivering. We're asking them to rate that service. We're asking them to score how they experience that service after they've received it. But on another, it's also about them being given the opportunity to give more detailed comment, to literally make some statements about things that they felt were going right and things that they were going wrong. That style of approach we're so used to in pretty much every other part of our life, whether it's in our travel agency or it's online. People are asking us what we think. It's time that the NHS asked its patients what they thought too, and that's what this is about and why it's so important. And what we've seen since the Friends and Family Test first launched last April in hospitals is that people really have responded to it enthusiastically. We've now had more than 2 million people give their views as to what sorts of things could be improved in local services and rate the hospitals at the same time. And that data is freely available for other people to look at. It kind of creates, in a way, a pressure for improvement. And we've had all sorts of incredibly positive feedback from the staff who are looking at those comments and they've explained to us how in a particular ward, in a particular hospital, they've been able to improve services in real time. You know, they've responded to a person's comment and been able to do something about it right there and then. What we know about this is that these really small things become big things if they're not taken into account early on. We've had some big tragedies in our health service where people have lost their lives, where harm has occurred because we're not listening to patients. And gradually the small things become more and more out of control and we end up in situations of real tragedy. So it is about, in a way, providing a modern level of customer service through listening to our patients that we will avoid, I think, or put ourselves at less risk at any rate of having true tragedies taking place in care. So the plan now is to build on the experience we've had as the Friends and Family Test has gone through its first phase in hospitals, and now to promote that more broadly across all health services. And from this December, we will be rolling the service out in primary care and general practice. And from next March, it'll be available in every NHS-funded care context. So I believe this will come to be seen as one of the most important turning points in the history of the health service. It is about giving patients voice, it is treating them with respect, and ultimately it's about ensuring we have a safe, sustainable health service that is responsive to the needs of those it is caring for.